Hello everyone. The next developmental disturbances affecting the shape of tooth, that is Talon cusp. Talon cusp is also known as dense invaginatus of anterior tooth. It is a well delineated additional cusp that is located on the surface of an anterior tooth and extends at least half the distance from the cemento-enamel junction to the incisal edge. In the picture you see there is an accessory or additional cusp which is present on the lateral incisor. The talon cusp, that is an anomalous structure resembling an eagle's talon that projects lingually from the cingulate areas of the maxillary or mandibular permanent incisor. In the picture you see here is a talon cusp. This talon cusp blends smoothly with the tooth except that there is a deep developmental groove where the cusp blends with the sloping lingual tooth surface. Generally, this cusp blends smoothly. In the clinical picture, you see arrow mark showing the talon cusp which blends on the lingual surface of the maxillary anterior tooth. It is composed of normal enamel, normal dentine, and a horn of pulp tissue. This anomaly has been discussed by Mailer and Deepa that patient complain of or emphasize the patient complaints in terms of aesthetic, caries control, and occlusal accommodation. 3/4 of all reported cases of talon cusp are seen in permanent dentition. The talon cusp predominantly occur on permanent maxillary lateral incisor, that is around 55%, in central incisor, that is the maxillary central incisor, in 33%, and less frequently on the mandibular incisors around 6% and maxillary canine 4%. And their occurrence in the deciduous dentition is very rare, with the vast majority noted on the maxillary central incisor or the maxillary anterior tooth. Then coming to radiographical feature, radiographically the cusp is seen overlying the central portion of the crown, and it includes normal enamel and normal dentine. Only a few cases of talon cusp demonstrate visible pulpal extensions on dental radiographs. Some estimates suggest that the frequency of talon cusp in the population ranges from less than 1% to 8%. Both genders, both male and females, may be affected, and the occurrence may be unilateral or bilateral. In this radiograph, it is a radiograph of talon cusp on a mandibular lateral incisor, the enamel and dentine layers within the accessory cusp. The accessory cusp or talon cusp associated with other developmental dental anomalies like supernumerary teeth, odontomas, impacted teeth, peg lateral, dens invaginatus, posterior dens invaginatus, and talon cusp have been seen in patients with Moore syndrome, Rubinstein-Taybi syndrome, and Sturge-Weber syndrome. Then Rubinstein-Taybi syndrome, which is associated with talon cusp, it is having some clinical features like developmental retardation, broad thumb, great toes, delayed or incomplete descent of testes in males, stature, head circumference and bone age below the 50th percentile. Next is the treatment plan for Talon Cusp. Patient with Talon Cusp on mandibular teeth often require no therapy, but present on maxillary teeth frequently interfere with occlusion and it should be removed. Other complications like compromised aesthetics, displacement of teeth, caries, periodontal problems, and irritation of the adjacent soft tissue like your tongue or labial mucosa or buccal mucosa. So many of the Talon cusps contain normal pulp. So rapid removal of the Talon cusp results in pulpal exposure. So removal without the loss of vitality, the tooth should be vital. That may be accomplished through periodic grinding of the cusp. So by the meantime, there is deposition of tertiary dentine and the pulpal recession. At the end of each grinding session, the exposed dentine should be coated with a desensitizing agent like fluoride varnish. So after successful removal, the exposed dentine is covered with calcium hydroxide and the peripheral enamel is etched and a composite resin is placed. So this is the procedure after the pulpal removal. On eruption, the affected tooth should be inspected for the presence of a deep fissure at the junction between the Talon cusp and the surface of the tooth. If a fissure is present, then it should be restored to avoid early carious extension into the nearby dental pulp. So these are all about the Talon cusp that affecting the shape of tooth. I hope you like this video. Thank you so much.